Good afternoon. Welcome to Friday Live with me. The last day of this week before I leave you for 2 days of relaxation, ample amount of preparation time. And then, of course, there are students who are going for exams as well. So, no matter whomever is going, all the very best on behalf of me and all from Neetu's family. And do not forget to pop into Neetu Madam's live tonight. Okay. So please do pop in so that you will all get some final last minute tips on the aspect of how to deal with it. All right. So what else could you ask for? Isn't it? This is one of the most beautiful day. You know why? Because tomorrow we have a lot of students who are eagerly waiting that big day for them. And few who are, like a bit anxious and all those things. It keeps on coming, isn't it? But come what may, we all are very much sure that you all will be having a lovely time because our prayers are always there, and that makes sure that you all cross over that big step of yours, isn't it? A big leap from where you are to your dream country. Good enough. So once again, all the very best to all of you. Savita Wins, good afternoon. Sidhu, good afternoon. Jilmi Joy, good afternoon. Sophia Agasti, good afternoon. Linju Raju, good afternoon. Nice. Denny, good afternoon. So if you are attending for the first time this live, please do let me know that you're attending for the first time and where you're from, if you could, because I love to know where all are you all, where are you all of you from? Atira Arun, good afternoon. Right, so a very good morning and a very good afternoon and a very good evening to all my lovely students. Why all these time zones? Because our students are all international, isn't it? Come what may. All countries that is across the globe, and most of you are almost from different parts of the world. You have people from India, Nepal, Sri Lanka, Maldives, Mauritius, Pakistan, Afghanistan, different parts of Middle East, different parts of Africa, different parts of Philippines, Indonesia, Thailand, Malaysia, Singapore, Australia, New Zealand, people from UK, Ireland, Canada, US, Italy, Holland. Not Holland. We have people from Scotland. Good enough. Denny Atira Arun, good afternoon. Shani Joy, good afternoon. Ambili Godwin, good afternoon. I am from Kannur. Nice, Denny. Thank you very much. Very kind enough of you to let me know that you're from Kannur. So next time when I'm en route to, or traveling through that way, I have a known person from Kannur as well. Good enough. Silky Sam, new name, Silky. Good afternoon. Although, at least I have seen most of you have an icon next to you. If you have not yet followed our page, please do click the follow button. If you have not yet liked our page, please do click the like button. If you have not yet subscribed to our channels, please do not hesitate to subscribe, because I can guarantee you that you will never be left empty-handed, because there are a lot of insights that you can get from all these joining. See, we would not promote anything unwanted. But again, of course, you have to understand this is an online platform, and a lot of fraudulent people are available right in front of you. Right now, there are a number of fraudulent people as well. So be aware. When anybody messages you saying, click that, click this and all, just report them and block them. We will not send you, neither ask you to click that or contact. If you need anything, there's a number there on the screen. It's 974-7944-374. Please do contact that number. They'll be happy to assist you. Come what may your queries are. Okay? Because you have to always remember, there are n number of exams that is keeping on updating on a daily basis, where if you are going to that one particular country is what your dream score or dream country is, there are n number of exams which can be only on to that particular country. So if you want to get more insights, please do not hesitate. We'll be happy to assist you, because day before yesterday, they started, and 12th February is what they're going to launch another exam, which is for one particular country. So there are n number of news happening. So that is also another reason why you're being asked to subscribe, share. Now, why share? Share is for me, because when you share, that means you're okay to, what can you say? You're okay to say that, okay, my classes are beneficial. That's it. Silky, sir, I have cleared my exam after watching your recorded video. Am I happy, Silky? So happy to hear that great news from you. Silky, you have been one catalyst for all my students right now who are there, who's going for the exams tomorrow. What else could they ask for? Isn't it a person who came and said, see, I have met my dream? And that can be an absolute motivating factor for all the students who are going for exams tomorrow. So congratulations, Silky. It is absolutely your hard work, isn't it? And I always believe hard work do reap benefits. All right. Congratulations, Silky, and would be happy to know what are your scores as well, if you could, and where you're from, Silky. Anju Nair, good afternoon. Abhirami Singamuthu, good afternoon. After some time, Abhirami, good. Tangasudha, good afternoon. So nice. So what else could you ask for? Isn't it on the verge of another exam? Thank you. Pleasure, Silky. Thank you for letting me know, and you have taken that, so much of a busy time out of your big life, and you came to say that you have made to the dream. Is an absolute honor to have students like you all. Good enough, good enough. I'm from Delhi, right? Good enough. So, Silky from Delhi. For some time, if I come in between to Delhi, I'll come and meet you, or else do enjoy your lovely life in your dream country. Monica, good afternoon. So yes, like what Silky just said, Silky from Delhi have made to her reality. So likewise, I'm sure that all of you would be coming and telling me, yes, I made to my reality. It's all because of your hard work. So again, because there are students who are going for exams tomorrow, the biggest tip that I could, good afternoon, could you please tell the last tip for tomorrow's exam? Neetu, I was just going to tell. So because you asked, see, first and the foremost important thing, do not worry about what others are gonna tell you. On the day of exam, there are students who will come and say, oh, you are doing that method, I do this method, I get 20 out of 20, I get 30 out of 20. Don't do that. See, that strategy is for that particular student. You have prepared all these while doing something, stick to it. Do not change on the aspect saying somebody else told something on the day of exam. No, that is for them. You are an individual. Whatever that you have done so far is what is beneficial for you. So please do not change anything on the last minute. Okay, when they tell you, okay, do this strategy, do that strategy. No. And also another thing is, do not touch the paper, the material that is going to come your way before they tell you to start. Okay, bring the pencil. Do not get panicked, because you have the innate ability and you have done so far whatever that is needed for you to get over that line. Another important thing, please do not miss any answers on the aspect. Do not leave any answers blank, especially with listening and reading. Whatever you feel, write it down. Let it be the wildest guess, no problem. Do stick to it. Please be a bit cautious on the aspect of managing time. Do not panic. See, before starting the exam, do pray well. Please do pray well. And when they tell you to start, don't waste any valuable second. If you don't find the answer, no problem. Skip that. Do complete the answers, because you have to always tell yourself, see, the answers for me is there in front of me. When you want to do speaking, do not worry about what the interlocutor. See, students generally have that myth, the interlocutor is not supportive. No, the interlocutor has an absolute clear-cut agenda on the aspect of what his or her role is. You don't worry about it. You just read what is given in front of you, do enact it. Give that maximum kind of according to the situation. If you are to console, you are to console. You give that intonation in your talk. Writing, Neetu Madam is going to give you a lot of insights tonight. Please do not hesitate to, or please do not forget to clock in tonight. And on top of that, read. Everything is there for you. Okay? And our prayers are always there for you. So I think that is quite good enough, isn't it? So do not panic. We'll all be praying for each one of you to make sure that you all go reach your dream destination. Monica, congratulations to Silky, Sanita Sabu, good afternoon. Grishma, good afternoon. Monica, please keep us in prayer. Whoever, of course. Tansiyar, good afternoon. Neetu George, thank you so much. Pleasure is always mine. Do not panic. You all have that innate ability. Okay, just to go and interpret it. Okay. Do to the best of what you could. Once you do to the best of what you could, mark my words, Almighty will grant you his part of 50%. Good enough. So without wasting your valuable time, we'll go into what we are supposed to, isn't it? We're going to talk about two things. One, a part B. Another one is a part A, which I've already shared. Now, come what may. Again, see, please do have ample amount of resources. Okay, whatever that is needed for each one of you to ensure that you're over the line. Okay, do carry ample amount of pencils, do keep your eraser if needed. Okay, keep your sharpeners, everything. Don't take any pen and all, don't try to write with pens and all. Okay, it's another thing, don't do, because when you mark certain things, you can't change when you're using pens. Chinese Soldier, good afternoon. So again, back to square one on the aspect. Do not worry on the aspect of too much on, oh, is it right, is it not right? You always stick to your gut feeling, because you have the ability and your brain will give you the right answers at the right time. Stick to it. Trust your capabilities. Right, so wanted to tell you something about the importance of enhancing your scores. And of course, these are the ways to enhance your score. Write legibly. Okay, when you are panic driven and all, don't try to overdo things and all. Keep it calm and composed, as what you have done so far. Do it. If the given space is not enough, this is another very important thing on the aspect of getting over the line. See, if the given space is not enough for you to fill in the answers, try to fill those space. Okay, you are expected to fill in that particular space, but if, let's say, with your handwriting or something, if you're not able to, do write the balance below the line, not above the other words and all. That's another important thing that you have to really look for. Okay, Prince Joe, good afternoon. New name, Prince. Okay, Anita Joes, good afternoon. Neetu Krishnan, good afternoon. So I'm not going to waste your valuable time. Let's go and do a part B, where the material will be coming up on the screen. As soon as the material comes, do picturize this as your exam material and try to do it as quickly as possible. Once you do it, do just put a thumbs up or say done. Don't write the answer. There you have the material. We'll discuss after. Okay, so happy because there were a lot of students who have said long time back as well. Saini Sojan, the first one to say done, Sidhu done, Anita done, Savita done, Atira done, Tansi done, Georgie done, Stephanie Angel, new name for me. Okay, but good enough. Done, Tangasudha done, Neetu George done, Prince Joe done, Monica Vegas done, Linju done. Good enough, good enough. So nice. Vismaya Nair, not done. Okay, Neetu done. Good enough. Akhilesh, I'm done. So at least I love that participation because a lot of students are eagerly replying, because your replying is what gives us that energy boost, isn't it? When you're all participating, that gives us more ample energy to come and uh, intervene on the aspect. Because if you reply more, we'll be happy to read all those, and that gives us a small, like this catalyst. Okay, this much amount of students are there in front of us who are actively participating. So thank you very much. Savit done, Narmada done. Okay, good enough. Now, would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. Yeah, 𝐿𝐴 done. Good enough. So please be kind enough to tell me what is your answer, where you got that answer from. That where is what I really love to look into. Neetu George, A from the second bullet point. Okay, fair enough. So first answer I have is A from second point. So I have my first answer in front of me, which is A. Monica is saying A from the fifth line. Okay. Sidhu, A direct answer, right? Let's see. So all the three students have told me all have one answer, but they have got from different perspectives. Okay, fair enough. Savit Twins is also saying A. All right. Good enough. Right. See, this is what I'm saying. You have to let me know, come what may. You tell me what is your answer. Like what 𝐻𝐿𝐴 have just said. 𝐻𝐿𝐴 is saying B. I have the answer B from middle. Okay, fair enough. Tansy is saying A, second point. Savit is saying second bullet point, A. Fair enough. So I have A and B as an answer. So you have to always remember, we are sitting here to learn. Learning is a process where if you make mistake, no problem. We are here to correct you and you can rectify it. That's how you arrive at right answers. Stephanie and Narmada B. Okay, B middle. Akhilesh B. Now B is also popping up. Savita B. I'm sorry, Savita second point. Okay, fair enough. Good enough, good enough. Vismaya A from second bullet point. Okay, fair enough. Neetu Unnikrishnan B from middle only mentioned risk. All right, fair enough. Right, now the question will be popping up back on the screen. Now, when you're doing part B, you have to always be cautious. Okay, cautious in the sense you have to read the question, underline the keywords in the question, understand the question. Very, very, very important. Georgie is also saying B for middle. Okay, fair enough. Now, Linju is also saying B for middle. Okay, fair enough. Now, see, question. So, keywords are long-term use of proton pump inhibitors may increase risk of. Okay, so when you're using this pump long-term, that means for a prolonged time, what may increase or what may increase. So you have to relate it to your questions. Okay, so may increase risk of some gastric cancers, may increase the risk of some respiratory problems, may increase the risk of cardiovascular issues. See, all those three are problems: gastric cancer, respiratory problems, cardiovascular issues. Now, let's see. Proton pump inhibitors. Proton pump inhibitors, see, I forgot to mention, elimination method is the most sweetest method that you can ever do to find the answers. Now, see how you're going to eliminate. Proton pump inhibitors rank among the top 10 prescribed classes of drugs and are commonly used to treat acid reflux, indigestion, peptic ulcers. Okay, so these pumps are generally used for this. Although generally assumed to be safe, recent studies have shown that they have numerous side effects. So they were generally assumed to be safe, but now they are saying they have some other side. Now, long-term use of PPIs may mask gastric cancers or other serious gastric problems, and physicians should be aware of this effect. Now, see, the problem is the increase of some gastric cancer. Increase of gastric cancer means who should increase when you're using proton pump inhibitors? It should increase the gastric problems. Now, the problem in here is they are saying long-term use of PPI There's a word called mask. That means cover the gastric cancer. That means they're not able to identify is what it means. So it is not increasing the gastric cancer. That already the gastric cancer is there, but it covers. Because of this use, they might not be able to find is what they are saying. Understood why A is not the answer? It's not increasing the risk of some gastric cancer. It is camouflaging it. That means you're not able to identify it. So that is the problem in here. So this is eliminated. Understood? Not increasing. See, this is why you should relate it to the answer option. Then only you will understand what is that. Increased risk of some gastric cancer means when you're using this, gastric cancer should increase. They are not saying like that. They are saying it masks the gastric cancer. So already the gastric cancer is there. They're not able to identify it because of this. Understood where he went wrong? So A is a straight eliminator from that. Not, let's see. PPI use has also been associated with development of microscopic colitis. Okay. There is also evidence that PPI use alters the composition of bacterial population inhibiting the gut. Okay, nothing to give anything of the three options. Associations have been shown between PPI use and the increased risk of pneumonia. So pneumonia is a respiratory problem. So yeah, maybe. Let's see. Association of PPI use and cardiovascular events have been widely studied, but no clear conclusions have been made as these relative risks are confirmed with other factors. Okay. So then what are they saying? Cardiovascular issues. They are not saying it is increasing because no clear conclusion. So that is another straight elimination. So 2 out of the 3 I have eliminated. So without any doubt, the answer is B. Because the last point, high dose and long-term use of PPI carries a possible risk of bone fracture, nothing to do with the given options. So understood why the answer is B. So congratulations for all those students who have got B. Congratulations for all those students who have got A. Why? You've been corrected. That small word, it is not increasing gastric cancer, it is masking gastric cancer. Clear? Any doubts? Anything that you want me to clarify? Understood, Neetu? Very good. Akila is dancing. Good enough. Why not? Isn't it? You're all supposed to enjoy your achievement. You should. Monica clear? Good enough. Good enough. Sidhu clear? Good enough. Any other doubts? Anything that you want me to clarify? No, Neetu Nigashan is also saying clear. All right. Aji Joseph clear. Good. Savita clear. Thank you. Pleasure. Any other doubts? No other doubts. Very good. So because you don't have any doubts, let's go into part A then. So part A, you're expected to tackle in 15 minutes. Okay, although we have said ways to tackle in 8 minutes, and we have told ways to get 20 out of 20. Excellent. So Tanthi is also saying clear. So today's part A material is hemi-shoulder arthroplasty. Okay. So I have told you the name of today's part A. Now I want you to tell me how you felt about today's part A and how many minutes you took in order to complete 20 answers. Please be kind enough to tell me how many minutes you took and how you felt about today's part A. Please be kind enough to let me, because I'm eager to read what are the things that you felt about today's part A. Because after reading, we always take utmost priority or utmost importance whenever you comment, because you are our patrons. Okay, because we give utmost importance to each one of you. That is why we ask you to comment, we ask you to tell what are your problems, then only we'll be able to address. Okay, if you say good things, we'll be happy to enjoy the good things If you want to clarify certain things, we are there to clarify. Come what may, we're all there for you. Savita is the first one to say 12 minutes, which is quite good. All right. Grishma, average material, 14 minutes. Okay, fair enough. Akila is saying tricky, but 12 minutes, good enough. Okay, now you have all the different perspectives coming in, isn't it? Which is the most important thing for us when we look into the next material, when each madam looks into, always look into all those things which are important. Because whatever you say is of, it's like gold dust for us, because we give that kind of an importance. Right, but only I have 3 students who have told what are the things that they felt about today's party. Now let's see, because the material will be popping up on the screen and I'll be shooting the 20 answers. Your job is to make sure that you tick, 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 and tell me how many right answers. So as I mentioned, hemi-shoulder arthroplasty, 15 minutes is what you get to tackle 20 questions. Jilmi Joy is saying difficult material took 17 minutes. Finding difficulty in finding answers, especially 1 to 7 massive following. Okay. Now let's see what it is. Yeah. So 20 questions. You are supposed to skim and scan. Scanning means detailed look. Skimming means quick look. Now in order to skim, they say 1 to 2 minutes. But I say take no more than 15 seconds. Enough. You'll have 4 text, which is based on one common thing. Okay, now when you're skimming, you are supposed to skim certain things. You are supposed to underline the keywords. So what are the keywords? What are the things that you have to really be cautious about? We have done an exclusive video on the very same page that you're watching, which dates back a bit. Go back to the old one where you have the maximum number of views. That's the clue that you can identify, which is the thing. And you will definitely know that is the material where we have given all the clues in order to enhance your part. Okay, now what to do, how to do skimming. See, skimming again and again, I would love to bring to your attention. See, don't skim like this. Skimming means keywords, means you're supposed to underline the words. My students they underline like this: shoulder replacement surgery, is no need, also no need, known as hemi-shoulder arthroplasty. When you underline like this, your eyes are not going to get into the word that is needed. Okay, so please don't do such kind of thing. So what you're expected to do, you are supposed to underline the keywords. Okay, see, replacement surgery is known as is adverse to the severe persistent condition of the shoulder or osteoarthritis in the humeral head is damaged with the shoulder pain as the routine activities and all non-surgical methods that fail, and then medication, cortisone, injection, physical therapy, and consider that the shoulder alleviates the pain, improves motion and strength and the function of the shoulder replacement uniformly, numerous factors on the patient activity, level age, overall health, and orthopedic surgeon should mention and determine the most appropriate. Done. So generally what is that? It is saying about the humeral head, it is saying about what are the other conditions, what are the management thing and all, medicines and all those things have failed, non-surgical ways. Likewise, you have to go through each procedure. So what are they going to talk about in part B? Sorry, text B, they're going to talk about how this is done. Text C, they're talking about the complications. What are the complications, adverse effects that can be? And you are saying about young people who are active and go on 65 years, then a study is coming. After this, now, Jilmi said it is quite challenging for 1 to 7. Now see, 1 to 7, you have to always remember there are 20 questions which are divided into 3. 1 to 7, you should know what are the numbers. 1 to 7, these are called match the following question. 8 to 14, these are called short answer question. 15 to 20, these are called fill in the blank question. So strategy, again, you are supposed to skim the text first. After that, you're going to go to the question. So again, question 1 to 7, these are called match the following question. And you should by heart all these. 1 to 7, match the following instruction should be by heart, where you're supposed to write any of these letters, and you may use any of these letters more than once. Okay. Right. Don't worry, I'm here only. There's a sudden power issue. So maybe, even though if you're not seeing me and all, do not worry. Okay, don't think that it is the ghost who's talking. Yeah, I am the one who was here only. Okay, so again, going back on the aspect, so keywords. Okay, after this, you're supposed to underline the keywords in the question. See, keywords in the question is also very, very, very important. Okay. Now see, objective of excising and incising connective tissues during the surgical procedure. So now this during the surgical procedure, where are they talking about? Do we need to worry about it? No, because it is clearly saying during the thing, they are saying in B only. Understood how you refer? Don't try to overdo things. That's what my students doesn't realize. See, in 1 to 7, you're not expected to find the exact sentence, exact word and all. So where are they talking about? And overall, so objective, what is the purpose? So purpose of cutting and chopping is what you generally say, isn't it? Excising and incising. See, if you want, where are they talking about? See, your nerves, blood vessels will be gently moved out of the way, and some muscles and connective tissues will be cut to access your bone. That's it. See, you don't have to worry too much about it. Understood? So next, see, now you have to always look into like that. See, procedural strategy, okay, orchestrated. So this is orchestrated means how you are arranging it for patients with many part fractures and dislocation. So now see, many part fractures. Now if you really look into, there is 1 part fracture, 2, 3, 4 part fractures and dislocation. So that is it. Go and write D. Circumstances, that means, okay, see, one should consider something. When you are circumstances, should the shoulder replacement surgery be contemplated? So contemplated means considered. So what are the things that you should really look into when you are considering? So considering is mentioned where? It is there in A. Why? You see, shoulder replacement surgery is advised to patients with severe persistent conditions of shoulder osteoarthritis and all those things. So that is the reason. So A, see, they are not asking you, see, you have to understand the keyword. This is why it's called keyword referencing. Okay. Now see, contributing factors. Okay, the causes. Simple way. Okay. Post-operative instability after. So post-operative instability, where are they talking about all these complications? See, this is how you look into. I'm sure that you are happy that you could see my figure in front of you right now, so that you can guarantee that it was never a ghost. Good enough. In which case can conservative measures be employed to maximize? So case, conservative measures, now conservative measures. Now, I like that word about conservative measures. Now what is conservative measures? Non-thing, isn't it? So where are they talking about all these conservative methods and all? Okay, see, managed without the need. Conservative means without the need of operation. So what are they saying? Non-operative is here. Yes, what are the conservative management? They are saying if no need, non-operative. That's how you refer. Finished, done, put D. What are the merits? Very simple. Advantages conferred. That means with regards to hemi-shoulder. So what are the advantages? Where are they talking about? Conferred means grant and all those things are meaning. So I would say A. Why A? See, they are clearly saying this a shoulder replacement surgery. That is what is hemi-shoulder arthroplasty. What can it do? It can alleviate pain, improve motion, strength, functions. Done. A. Now, which category exhibits heightened susceptibility to progressive glenoid arthrosis? So where are they talking about? Is it under complication? Yes. Do we really need to worry about is it mentioned there or not? But since because you want, I would definitely show that as well. Why? Because it is there under instability. All the other keywords are there, isn't it? So progressive, glenoid and all those things. Done. See, you have to always look into the aspect of, so that is a straight thing. Okay. Okay, fair enough. Now the next set of questions, 8 to 14, these are called short answer questions, where the instruction says it can be as simple as that of a word, short phrase, that means anything between 2 to 3 words. It can be words or numbers or both. Straight. Now strategy doesn't change. Underline keyword. So what is a term for the condition arising from axillary nerve injury resulting in a blend of functional loss and pain? So term. So that means some name should be given. Again, go to see what is a name given. So they're saying critical shoulder caused, axillary nerve is here, loss is here, function is there, pain is there. So what is the term? Deltoid dysfunction. Ratio 7 out of 7, good enough. So DELTOID DYSFUNCTION. Savita 6, good enough. So a condition, again, they're asking you about a condition marked by its intensity and enduring nature, necessitating treatment through the shoulder replacement. So a condition which is asking you to give treatment. So definitely in A, isn't it? What is that? So they're saying the osteoarthritis is in which only humeral damage, and this has been done by the help of shoulder replacement surgery. So very straight answer. Now what material? So something which is to be employed to bandage. NK is the incision procedure. NK means cover. So where are they going to talk about all these? Again, during procedure is something definitely, yes, it is going to have. So what are they saying? Is there anywhere which is saying that what should be covered? So your incision should be bandaged and wrapped using gauze or gaze or whatever you say, your technical term, isn't it? GAUZE. What age bracket? So that means age typified by the individuals in the cohort. Cohort means go straight to D, healthy workers. Now where are they talking about? Healthy workers and all? Yes, healthy workers. So what is the age bracket? Less than 65 years. That's it. Done. So in the procedure, which bone's generated head is excised, substituted with the stem of processes? So definitely which one? So definitely it should be there in B, during, isn't it? So now let's see which bone. So what are they saying? The damaged head humerus is all there, which is maintained, degenerated. The long portion of the humerus will be fitted with the stem processes. So throughout the paragraph it is talking about humerus. HUMERUS. You're all excellent students. All of you are saying the right answers. Which pharmacological interventions is necessitated to ameliorate? I love this word ameliorate. Why? Ameliorate means mitigate, lessen. So they are saying what? To lessen which? Hypotension. So where are they talking about hypotension? That is one. So ameliorate means better, isn't it? So lessen means you better hypotension. So ameliorate means lessen, make it better. Okay. So make better hypotension, which is going to be? Where are they talking about? Hypotension. Go to C. So hypotension is there. Yes, it is there. Now which is the thing? Vasopressors. VASOPRESSORS. Question number 14. In cases of patients, so cases of patients means go straight to D. Now, stable, anatomical reconstruction, which management approach would be considered apt? So something which is better. Okay, so where are they talking about? Which one to consider? So stable and anatomical reconstruction possible. Yes, so they are talking. Sorry. They're saying hemiarthroplasty because that is no need, isn't it? So this is not necessary. That means they're going to make it HEMIA RTHROPLASTY. Good enough. Now question number 15 to 20. These are called fill in the blanks question. So what is it? Instruction remain the same. Word, short phrase, or it can be number of words or both. Now dash may manifest during hemishoulder arthroplasty, particularly with compromised bone quality. So something is just going to ensue. So complication, is it? Definitely it's a complication. So what are the complications they're saying? So hemishoulder is being carried out treating fractures, and there are always a risk of fracture malunion. FRACTUREMALUNION is the answer. Good enough. Dash is imperative, okay, provided the patient can endure stability, anatomical precise reconstruction. Again, so something to endure. What are they talking about? If the stability is yes, so that means they are able to endure. So what is the thing? Locking plate ORIF is the answer. LOCKINGPLATE So when conventional treatments like anti-inflammatory drugs, dash, and physical therapy yield no result, shoulder replacement surgery becomes a viable option. So that means only when this is not there, it becomes viable. So definitely it should be there in A, isn't it? So all the others are said. What are they saying? So if they are saying if the anti-inflammatory is there, cortisone injections are the one which is missing, physical therapy is mentioned, shoulder replacement should be considered. All the other keywords are as such there. So the only thing which is missing is cortisone injections. So CORTISONEINJECTIONS. Now question 18. Post-operative dash is relatively more common after hemishoulder arthroplasty, highlighting the intricacies orthopedic procedure. So they are saying about all those things that is needed. So complication again, yes, I would definitely say yes. Now where are they talking in complication? So they are telling instability is all the other relatively more common post-operative complications. So the only thing which is missing is instability. INSTABILITY. The penultimate question for this week. The dash is tasked with meticulously assessing, comprehensively scrutinizing, and determining optimal shoulder replacement. So where are they talking? The dash, who is tasked? That means it should be a person, a specialist. So where are they talking about specialist? Definitely in A. Who is a specialist? An orthopedic surgeon may thoroughly screen each patient to determine the most appropriate type. So orthopedic surgeon. ORTHOPAEDICSURGEON. The ultimate question for today. Delicately repositioning nerves and dash access to the bone. So something to look at the bone, facilitated by incising specific muscles and connective tissues. So definitely during procedure. So where are they saying? Axis is there, bone is there. So something which is muscle, connective tissue, all those things are there. So what is the only thing which is missing? Nerves is mentioned. The only thing which is missing is blood vessels. BLOOD VESSELS. So I have wrapped my 20 answers. Please be kind enough to tell me if you have any doubts with regards to any of those questions. If not, do shoot me what are your total scores. Eagerly waiting to see. Even though I don't have much of an insight on the aspect, because not many have told me that how you felt about today's material. So I think all of you think that it is easy. So let me see what are your total scores. Let's see. Please do shoot your total scores. Sidhu 15, good enough out of 20. Okay, fair enough. How about others? Right, if there is any doubts, please do clarify. Is there any doubt with regards to any of those questions that you want me to clarify, which you're not aware, which you're not sure, anything like that? Savita 18, good enough, keep it up. Reshma 18, good enough, keep it up. Like some, it was a bit hard, no problem. See, your job is to make sure that you're saying, see, this can be a material that can come on the day. Once you get exposed to all these things, then on the day of exam, you're not going to panic. That is our perspective. Yeah. Akila 17, good enough. Ivira 18. Part A 5, sir. Okay, no problem. Savita is saying tricky material. Do not worry. You will come up better. See, that 1 to 7, that's just because that your keywords are not really looked into. Synonyms is what the whole idea behind why you're getting exposed to part A, or you feel part A is a bit challenging, is you're not used to those keywords. See, but even in that keyword, the word that you don't know, there are other words that you can easily relate to, because you're only expected to find which part that thing is going to come. Okay, which text? Fair enough. Raisama 17, Jilmi 15. Okay, good enough. Sidhu, don't worry. The whole reason to make you feel challenging is to make sure that you're getting exposed to, so that you do not panic on the day of exam. Neetu Unikrishan 14, absolutely good enough. Why? Because it takes a strong person to come and accept what is the score that you've got, even if it is least. Absolutely good enough. So that's the part of learning. So if there is 9th answer, osteoarthritis. You get that from text A. Right? So because you don't have any other doubts, so it's high time that I'm going to say I'm going to miss you all for the next 2 days. But yes, of course, for all the lovely students who have got their exams right in front of you tomorrow, all the very best. And my prayers are always there with you. Do go enjoy your exam. Do not worry about it. Do enjoy your exam. All the thing will come fruitful for you. All right. Until and unless I see you all on Monday, adios from me. God bless you all. Take care. Bye.